Hi there, and greetings from Japan. Please bear with me because I sound sick and I have been sick for the past 2 days. So please bear with me as I would like to share my experience with you regarding the healthcare system here in Japan. I live in Sasebo. I've been here for quite a while. Got out of active duty and pretty much stayed here in Japan. And I would like to let you know that what the book says about the healthcare system in Japan is true. As you probably already know, Japan has the universal healthcare system, and government pays 8.5% of their GDP towards the healthcare system. But despite of this, Japan is considered to have one of the best healthcare systems in the world. All are required to have health insurance, and it's not bad at all. The fees paid for their insurance are affordable to ensure all have access to care. My wife used to pay 5,000 yen or 45 bucks monthly for her and her two children before we got married. As part of this coverage, patient covers 30% of the medical expenses and the government pays the other 70%. Um, Including this coverage are pretty much everything they can go through for their prenatal screening or uh, screening examinations and whatnot and whatever everything they can do that with their health with the healthcare. And annually, according to my wife as well, she was telling me about this that they were given free full body checkups, from mammograms, MRI, CT scans, everything. They have a checklist, and they can go seek and get checked for all of that. It's included on their healthcare. And for those who are not employed, they also are given assistance from the government. They can still have a healthcare coverage. So basically, they have everything. And for those who are low income and receiving government subsidies, fees are waived, so they still have healthcare coverage. Based on my personal experience here, being in Japan, getting seen off base and getting seen in the medical hospital, Japanese hospitals, the quality of their system is great as well. I have received care from them. Um, First, when I got my stent implantation 3 years ago, and recently for a follow up for this stent implantation, it took me 3 years to get seen. That was on me, and both were done great, expeditiously processed. And the hospitals are old, but their job performance are commendable, really. And there was no need to go building to building to get seen to get everything done. Unlike back in the states, you got to go from another building to get the x-rays done, another building to get your labs done. Not here. Everything is in place. So pretty much for me, when I get my appointment done, labs, x-rays, EKG, ECG, and doctor appointment done in 3 hours. And it was also the same thing when my wife first gave birth to my daughter. All I witnessed it firsthand. And she was given this resto type meals all throughout the week, including massages and baths for her 1 week stay at the hospital. She was given a awesome treatment, and the cost of the healthcare system also here is affordable. Again, the 30% you pay, but 70% of the government. But my last appointment, which again the X-rays, EKG labs, only cost me $250. I have an appointment coming up, which is in about a month from now, and that includes a CT scan and 2 days stay, two day confinement, and that make $400. But again, 74% of it will return to me because of my TRICARE, and again that applies to the rest of them as well. It's a good deal. And also for the patients here, they have the freedom of choice for their providers. They can see a specialist without getting referrals from their providers, which is awesome as well. My children they can go to dermatologists if they want to get seen for their eczema or whatever not. But that is another great thing for part of the healthcare system. So again, I'm done with the presentation, almost 5 minutes. And again, the Japanese healthcare system is awesome, and this is one thing that the U.S. should think about. Have a good day.